Okay, let's bring the Lakeshore Hospital Authority Board into order. Any staff or trustee addition or deletions to the agenda?
Chairman, staff has no additions or deletions.
Okay. So can I get a motion to adopt the agenda?
So moved.
Second.
Okay, motion and a second. All those in favor say aye.
Aye.
Motion passes unanimously. Did I hear you say that? Okay, just. All right, I've got 3 public comments here in front of me, so I'm gonna go on to them. Miss Lucretia Smith.
She's served at the bottom, I think she's at the pole.
Oh, I'm sorry. Look at that. I can't, thank you.
Doesn't matter, I always have to be done.
All right, Sylvester, you didn't circle one. It just says public comments.
Yes, sir.
You wanna go first?
Yes, sir. Thank you, Mr. Chair.
No worries.
Mr. Chairman, I normally freestyle, but I brought my folder and wanted to make sure I carefully lay out my words. For the record, select one, the third. Mr. Chairman and board members, there are a few things I would like to say because once I finish speaking, I'm leaving. I asked Mr. Chair that you would allow me some leniency on speaking time. I would be very professional and demonstrate decorum.
Okay.
First, I would like to thank each and every non-paid board member for serving on the appointed board. This board is designed to solely make sure all medical needs for the underserved is being met with every building and grounds the Lakeshore Authority Board owns. I would say all board members have stuck it out to get medical proposals in, and things seems to be heading in a good direction at this point, as long as you board members stick to your word about medical needs above all else. However, I don't lack knowledge or wisdom in the fact that most of you all board members know Executive Dale Williams, and some of you all are his friends. Putting feelings and friendships to the side for a second, I personally believe Dale was and has misguided this board in getting true medical businesses in the vacant buildings. I have said it many times. Dale Williams served too many masters and has given less than his best in filling the needs of the medical services for the underserved. So many red flags are overlooked because it's Dale Williams. When the executive director of medical campus presents to you a pre-laid out lease from the Third Circuit, that was a red flag. The way Mr. Williams deliberately drove things along to get some of you so frustrated to the point that you were willing to surplus the campus, another red flag. In almost 2.5 years, Mr. Williams has brought nothing real or concrete to this board regarding medical service. Mr. Williams claimed there was nobody just interested in medical service at the Lakeshore campus. When he claims this existed in 2.5 years, I found all these folks in 1 week. Another red flag. That said, I respectfully ask that Mr. Dale Williams to resign effective immediately, or I ask that the board remove him tonight. Also, Attorney Todd Kennan has been practicing family law for the last 20 years, has no experience in municipality law, nor laws that governs the authority board. Therefore, I respectfully ask Todd Kennan to resign effective immediately, or I ask that the board remove him tonight as well. Lastly, he's not here, but Dick, you are a good guy, but don't let some people pull you down to the level they are on or use you personally or politically. Many people speak very highly of you. Thank you, Mr. Chair, for allowing me this time to live out my First Amendment rights. Thank you.
Thank you, sir. Ms. Lemley, you have You circled all.
Yes,
Do you have any comments?
I do have one general comment,
Okay,
is that.
yes, ma'am.
Sylvester brought up several points. However, myself and students for years have tried to get other persons in a position of authority to look at the board. This is not a legally constituted board. And you took an oath of office to follow this. And you're not. The board attorney, both present and prior, totally disregarded it. Even when it was in the county's hands, they totally disregarded it. And there's supposed to be a practicing physician at the hospital. If there's no hospital, and the authority just needs to go away. And as far as the comments of the Third Circuit in the building, this board has never really followed its rules. So I don't know what the big deal is. Why doesn't this board give the building to the county? Thank you.
Right. That exhausts all the public comments that we've got for the first portion of the meeting. Moving on to the next portion here, approve the consent agenda.
That's a motion to approve the consent agenda. Second.
All right, motion and a second to approve the consent agenda. All those in favor say aye.
Aye.
Aye, that approves, passes unanimously. On to our new business. The first topic of discussion is discussion and action for approval of a new copier lease. Mr. Williams.
Yeah, thank you, Mr. Chairman. The current lease was for 60 months, 5 years. It will soon be expiring. We have the opportunity to renew a lease for a different machine. The lease payment would increase $27 a month on the new lease. However, the average monthly service cost would decrease $127. So we have the opportunity to enter into a new lease, get a little bit better, faster machine at an overall reduced cost. And therefore, we would ask approval of the proposal and ask the trustees to authorize us to enter into the new lease.
Wishes of the board.
The comments.
Oh, sorry. Appreciate that. Any public comments on the office copy?
No.
Are you sure?
Yes.
Okay. Wishes of the board.
Make a motion to authorize staff to enter into a new lease with the Criminal's Office Systems for the new copier.
Second.
Motion in a second. All those in favor or any other further discussion? Nope. All those in favor saying aye.
Aye.
Mr. Chair.
Yes, sir.
Just want to thank staff for looking out. That's $1,200 a year, we'll see. So,
Yep. Yes, sir. All right.
I'll second that. Oh, what the motion?
Was getting confused there. On to the next item, discussion and action, Mr. Todd Cannon, legal requirements for the taxing districts.
Yeah, the legislature passed some new ethics training. They included additional entities, and those serving on the additional entities. Mr. Williams asked that I review that regarding whether y'all had to undergo the 4 hours of mandatory ethics training. I walked right out and left the statute, but essentially it applies to the elected members of these types of independent districts and not appointed. I called the Commission on Ethics, who is always very helpful. Gave them the statute, gave them our requirements for appointment, and she confirmed that this for elected persons only for independent districts, so it would not apply to us. She did encourage everyone to do it though, and I told them I would pass that along. But it's not a requirement, so when you fill out your forms, disclosures, you don't have to check that box.
Excellent.
If I may, Mr. Chairman, to add one more thing to that, just to remind you trustees and for myself, this year, the first year, you are required to file your financial disclosure electronically. The due date's the same, it's July 1, but you have to file it electronically. The paper form carried to the supervisor that we've done in the past is no longer the requirement. So if any of you need help with your financial disclosure, Sonia will be more than glad to help. But we just want to make sure you understand that that's the way that you're now required to file your financial disclosure.
Thank you, Devin. Moving on to some unfinished business, discussion and action, doing a progress report from staff.
Let me defer to Mr. Kennan.
Yep, we have the survey from Brit Surveying. I was gonna go out before the meeting tonight, albeit for the rain, and try to line up some landmarks. If it's not raining tomorrow, I'll do so, but that's available if anybody wants to see it and go make a visual inspection. The second appraisal on the block 111 is moving along. The guy in charge, hopefully I'll talk to him in the next day or two, is not in. And I'll be able to get Mr. Williams a definitive time frame, hopefully by the end of the week. That'll be the last cog for the Masons issue. So once I have that time frame, I'll call and notify Mr. Williams and Sonia, and we get that information out to you.
Mr. Chair,
Yes, sir.
would it be appropriate to say that at the next meeting, we could have whatever those two amounts are on the agenda, and us be able to vote to send the check to the Masons?
That would be my hope, and when I talk to them, I'm gonna ask them, can they meet that deadline for the
No,
June meeting?
no, they can't. What they are required to do when they get a proposal is send a letter out to all of their membership and meet 30 days later to vote on it.
I don't think this would be a proposal. This would be sending a check, because the way that the deed is written.
They won't be able to accept it or deny it until they get that vote.
But I think we can go ahead and do our part of it.
Right,
And
right.
then,
I'd like to say that would be my goal, is to have this part wound up at the June meeting.
What was the appraisal released? He was released what, last meeting? So he's 4 weeks in, more or less?
Well, by the time we had to locate a different vendor, we
Yeah.
were looking at a local vendor. They wanted almost 3 months and almost triple.
Yeah,
So we located one in Jacksonville. We sent them the information. They've had it about 2 weeks.
2 weeks, okay.
Yeah, so hopefully with
That's-
the information they
That's
have,
enough time.
it'll essentially be, I'm hoping it'll be confirmed comps, and those are comps on parking lots.
Yeah.
Essentially, so.
Yeah.
Generally, there's not many of those and they can be easily identified, so I'll be working with him to meet that June deadline.
we
It'd
can
be-
have
it'd be
it on the
close.
agenda.
That's probably enough time to get it done.
We can have that on the agenda then.
Yeah, we'll make sure it's there. May I ask a question?
Yes, sir.
Mr. Chairman? Todd, were there any encroachments shown on the survey?
No, that's what I was gonna go out and try to walk it. I know it went up pretty close. Oriented. That went up pretty close to what looks like to be planters of some sort. I'm not sure what those are. I've got to align my streets with this, bounded on one side by North Leon Street. And I did note that, as if you recall, when Chase Moses did his, they did some sort of overlay, maybe from a satellite
Yeah.
type deal.
Probably the GIS.
And it didn't look like from his that block 111 extended all the way to what the parking lot is currently configured. And this appears to confirm that there's so many feet between the end of block 11 and the end of the quote parking lot as it's configured. So that was kind of confirmed. And again, I just need to see how close it comes up to the actual hospital building itself.
Okay.
And I've got, for those more knowledgeable about surveys,
I was about to say, I can, you got a copy of there, I'd be happy to put my eyes on it.
I'll get you one before the meeting back. Make sure I got plenty.
Okay. Um. Yes, ma'am.
I have a proposal to make. Could we do a conference call when we get the answer on that? And take a vote? And then send that to the Masons? Then it wouldn't be by our June meeting. But we might be able to have a special meeting in June and finalize that.
Can we do that?
I think it'd have to be an actual.
That's good. If that's a call meeting, but
We could do it over the phone?
I don't believe so off the top of my head, but.
Yeah, that's the thing. I didn't think we could, because don't we have to make a note, don't we have to 2 weeks out or something like that to tell them that we were gonna have the call? I guess we could do it now.
Well, once I have the date, I can provide it, and then we can,
Yeah.
staff can then get word out to see if that's feasible and worth it. You know, if it's gonna be 5 days before the June meeting,
Yeah.
that'd be up to the boards and trustees and staff.
Do you have a date in your mind that you're trying to hit?
No, I just was throwing that out.
Yeah.
Because y'all are talking June, and by the end of June, we could have a decision then, but not if we're gonna have to jump through all the hoops here.
I still think that all we would be able to do is go off of the two appraisals and say, here's the amount, write the check, we can send the check, and then if they decide not to accept it, that's. I mean, we're doing what the deed says that we're supposed to do. Is my understanding. I don't know that I don't think we can negotiate.
Yeah, that's true. I don't think we can negotiate. Right? We give them the max value that we can based on the appraisals. Is that?
That would be our obligation under the reverter clause, as I read it, yes.
Okay.
Mr. Chairman. Do we be between Mr. Kennan and Mr. Williams, do we have any update from Meridian? Any talks with them or?
Last I talked with them, they're waiting on us to resolve this issue and
Great.
sitting tight where
We're
we
still in
ended
a
up.
holding pattern.
Yep.
Thank you, sir.
Likewise, Mr. Kennedy, I spoke with one of their board members about a week ago. And I basically received the same information.
Thank you.
Okay. All right, so I think we got. Do it.
Because of all the technicalities in parking,
Yes, ma'am.
I haven't been able to find where that parking lot is absolutely necessary for ACA requirements. If so, North Florida Regional would not be in the situation they're in. Plus, there's parking lot there. And where the old EMS building was, there's parking there. So if it doesn't work out, there's other options. And the helicopter pad, what's the status of that? Does Meridian think they're gonna need a helicopter pad?
No, well, the only thing that I have said, and it's subject to trustee approval, is if it is transferred to Meridian, then any and all obligations related to keeping that a licensed pad would become their responsibility. But that's subject to the trustees approving it. But if they want it, they're gonna have to maintain it as a helipad because we're asked by our emergency responders to keep it open. It's not used often, but when it's needed, it's needed.
Do you know how many parking spots besides the big parking lot there are available? Like where the physicians parking, here and
We,
there.
we calculated the number and actually presented it in a meeting one night, but I do not remember the number.
I don't recall it either. You're looking at me. I'm sorry.
But we do have it.
Plus, you know, there's parking, and I would hate to see this deal go down. Because as the board knows, you can only pay so much for the parking lot. And I don't think Meridian would totally object if they parked over there. You know, they can get somebody to serve a golf cart and take the people back and forth. Might do be good to have some people walking and get some steps in.
I appreciate that.
So hopefully something will be resolved very soon. And the last comment
Yes, ma'am.
is that there's what, 16 or 18 clients? And the cost per client to maintain all of this stuff is outrageous. I don't think we're ever gonna get any more clients, probably because Lake City Medical Center has probably a charity care program. And we just need to disband the authority. Thank you.
Thank you, Ms. Lemon. All right, don't see any other further public comments on here, so let's move on to the next line item. We were talking about discussion and possible action responses for the RFPs. I do have a public comment on this, Dale, from Miss Lucretia Smith. And this is the appropriate time for that comment, I believe, right?
This would be it.
Let's see, I did it right this time.
Yes, you did.
Yes, ma'am.
So, I'm here to make a proposal on, a multiple volume business that I have is, pretty much you will be able to come in and provide services to the patient in home or whatever. And the name of my business is, Supreme Extreme Mobile Lab. It provides a concierge service. The value resources save time in finding transportation for the patient, including the ones that need assistant devices to be removed from their own location. Our mission is to provide quality care, affordable and worry-free phlebotomy support. By providing the services to individuals in their own environment, we will reduce the anxiety and stress. Our blood work is a huge critical component in the journey for good health. Our company will provide stat labs, routine labs, and urinalysis. We will transport that to our laboratory, or if y'all provide a laboratory in-house, that's fine as well. But what we do now is we will take that kit, we will get a kit from our preferred laboratory, and we will take that blood collection to our lab to be processed. And then the physician can make its diagnosis and prescribe any medication that is needed to that patient. Along with our services, we will provide a strong communication skills with that patient to let them know exactly what services we are providing for them when we come into their environment, which is in their home. And we will also bring critical thinking and safety, because in my experience in the 20 years being in this nursing field, I know that sometimes being in this environment, when you take the patient outside of their comfort zone, it can cause fear, confusion, and sometimes combativeness, with going into an unfamiliar situation or area. And we will bring a solid understanding of who we are as phlebotomists, so that they will know that we come in to do blood draws and make sure that their health is our first concern. We will only hire certified phlebotomists to come in with my company. And that we will also ensure that our accurate lab drawings and readings are accurate by providing a policy and the procedures to be established so we can move forward to get accurate reading. Now, this is a good value to this company because we will continue to make sure that we have health control. And we will also bring a strong strong communication skills to this facility. Critical thinking, meaning we will be able to make a decision at any moment and keep the patient safe. And so with all of that, we will make sure we continue to have time management and making sure that our biggest, concern would be safe for the patient and the staff with bringing on communications between us all. So if you have any questions as of now, that's all I have to present to you. If you understand what my company will bring to this company.
Yes, ma'am. And that's medical, I heard medical transport, just making sure I was clear on that.
Phlebotomy
Okay. Body.
and, bringing in coming in and doing blood draws so that the patient can be in their safe environment. They don't have to go outside of the facility to go to a laboratory and get blood work. We will come to you.
And does Dale have any of your company's information?
I
Or did you
Yes,
guys-
sir.
okay.
I have everything sent to him and I can get it to whoever needed.
Just wanted to make sure.
Is your company presently established?
Yes, I have, experience with working with, another company as well right now with all the training that I have. I started out working with another company, but my company is fully ready to go. I have everything, insurance, everything that's needed.
Okay, now you're talking certified lab techs.
Yes.
And what is your background again?
I'm phlebotomy as well. I've been nursing assistant for over 20 years. So I've been in ICU, working ICU, traveled all over the world and saved many lives.
Okay, I know this is very necessary thing. We have a number of people in the counties and the surrounding counties that it's difficult for them to get out to go to a doctor's appointment, let alone just to have labs drawn. And they have to have it because of their conditions.
It makes it easy for the phlebotomy, for the physician to be able to put in an order and we come in. As soon as we'll have a routine, every day we can come to the facility and, we would go to the nursing station and they will provide this right here. Usually we would have something like an order. It would be a sheet like this. And this is a simple sheet where they will put in the patient name. This is just an example. This is put in the patient name, their date of birth, the physician who put in the order, and all of these are the type of labs that they can select. It's very simple. They can select any one of these for each patient, what they need, and we will come in and we will go to that patient room and we will draw the labs that that patient needs.
And that would be like nursing homes.
Yes, nursing homes, hospitals, and all of that.
Okay, and then the private homes, would they also have a form like that?
Yes.
Sure. Are you interested in having a physical location in one of these buildings? Is that,
Yes, that's optional too. If we have a physical location, that would be great, and we can go in. I'm not sure if y'all have an actual lab in the facility. If not, we have labs, we can go take the draws to. And then we'll be able to send it to the physician to make sure he get the results.
Any other comments or questions? Okay. I appreciate it. Thank you very
Thank
much.
you.
Miss Lindley, you had you're circled. I'm gonna touch base with you.
Yes. Looked at the proposals, hers was in the original response. And what exactly, she would just like to lease space for her operation, is that correct?
Well, I don't know exactly what Lucretia is gonna need to support her business. I've not had the opportunity to sit down with her and talk about that, but that's next steps.
But do all the proposers realize the authority cannot underwrite any private for-profit operation? They may well aware of that.
I don't know whether they know the limitations of the authority or not, but as we sit and talk, we can certainly provide information. They can provide information to us. Barbara, what we hope to be able to do is to create a campus where basic medical primary care needs, pharmaceutical needs, and wellness needs can be met. And it takes disciplines to do that. That's the hope.
All of these things are basically a pipe dream and it's gonna explode. And I think all the vendors that made proposals need to be sent something saying, hey, we can't give you any money. It's not within the authority of this board to do, because
Barbara, they want to give everything to Meridian free and clear. That's. So, I mean,
you're entitled to your opinion.
that's what
But
they're doing. That's what they're
This
talking
authority
about.
has done whatever they wanted to, even though it's totally against policy and procedures. But sometimes we have to do what is the right thing. Thank you.
Thank you, Ms. Summer.
It's against policy and procedures, gentlemen, but you can give it away.
Absolutely.
Can I speak?
If we can be
It'll be
brief,
1 minute.
yes, ma'am, just let's keep warm up, let's be brief.
My name is Barbara Karpinski.
Yes,
I
ma'am.
was in the nursing program and I was at Netfish in October. And just to let you know, it costs a lot of money to take a person of that caliber to an outside appointment, and they are they have gynecologists, they have x-ray, they have a bunch of doctors there. They spend $634 million now, operation wise, just to let you know. Have a good night. Thank you.
Yes, ma'am.
I think Mr. Neal on behalf of Life Tree is trying to speak on the Zoom. I got a message.
Okay, let me see. I thought I was keeping my eye on this thing a little better. He doesn't have this. So they got it. How do I just unmute? So Mr. Neal?
Yes.
Derek Neal?
You might have to show him how to undo it.
All right, Mr. Neal, I'm gonna unmute you.
Hello, board. Thank you for the opportunity to speak with you all. I'm sitting here with me and my wife, Jamie Neal, and we own and operate Life Tree Women Care here in Jacksonville, Florida. It's a women's care clinic that provide birthing services and ultimately primary care for women of all ages. We're qualified to take care of women pretty much from their menstruation cycle until end of life. We do a variety of services here right now. I have my wife here to speak as well as far as on the medical side. We are up and running. We are a practicing facility, delivering at the hospitals, and also specialize in various other means of healthcare to provide healthcare being provided in lower minority communities. If you allow us a moment, she can get a little bit more in-depth information as far as the direct services that we offer for women in our community now.
Good evening, board. I'm Jamie Neal. I'm the wife of Derek Neal and co-founder of Life Tree Women Care in Jacksonville. Currently, we, as Derek said, we do offer services to women, medical care services, including primary care, women checks, STI exams, prenatal and postnatal care, hospital births, and just all kinds of gynecological appointments. And we are fully operating right now, accepting insurances and self-pay and Medicaid and all. And
And we are also set up as a for-profit, and we're also set up as a nonprofit. So we have both entities operational. We've built the business to a point where we can definitely scale, and we are actually in talks with some more hospitals in rural areas to duplicate our model. So when we heard about what was happening here in this particular community through Dr. Mayo and Mr. Sylvester, we said this is exactly something that we're already replicating up here. So to be a part of this meeting and to find out about this RFP, excuse me, to find out about this RFP was actually a good thing. So I'm glad that I actually called this meeting because I did not know that the meeting was tonight. We do have a meeting with Dale, I believe it is tomorrow. We have a phone conversation with him. But I did pick up a lot tonight, so we want to introduce ourselves to you all. Feel free to look us up, lifetreewomencare.com. Again, that's lifetreewomencare.com. That's just how it sounds. We're both veterans. We're both college educated, and we're ready to help the community.
Excellent. Thank you. Anybody have any questions for Dr. Neal? Just while I'm sitting here, I know he can hear me on my mic.
Not at this point.
Okay. All right. We appreciate your time, Dr. Neal and Jamie Neal. Thank you.
You're welcome.
thank you.
Real quick, before I do anything, is there somebody else trying to?
No, I was just gonna say, if you wanna just make an announcement that if people wanna speak, the way to raise their hand is to go down to the word more at the bottom of the screen, hit the three dots.
Okay.
And then go into reactions, and you might not have that since you're a host.
Okay. So just to make an announcement for everybody online, if you wish to speak right now on this last item, or if I have another presenter on here that I don't see, if you could raise your hand. If you click on the more button, there's an opportunity to raise your hand. So I just want to let everybody know, if you click that, raise your hand, I can call on you. Otherwise, we're going to move on to the remainder of the update from Dale.
Gotta go on to reactions.
Go down to reactions.
Yes, that would raise your hand. Like a small.
Well, you click on more and then you. I'll wait for the things there. I'm not seeing it. So, Dale, if you would continue on with the update.
Thank you, Mr. Chairman. I'd like to have a discussion with the trustees. No action is requested from what I'm going to tell you, but I kind of wanted to explain where I see the authority and where we're at in terms of potential options. And I tried to capture a lot of this in an email, which I had previously sent you, but I sort of wanted, or I did want to explain some of what was included in that email. First of all, we did receive 5 responses to the RFP that you requested. You've already heard directly from one of the respondents, which was Lucretia, her company, and we do have that information. It wasn't necessary, but we did ask Dr. Mayo to submit, and the reason for that is we had 2 previous responses where we were not able to vet anyone. We were, with your approval, negotiating with Erica. So when you opened up a new RFP, we asked her to simply respond to that because it's just a housekeeping measure and makes it very clean and neat. We did receive a response from Dean Early with Florida A&M University. We received a response from Columbia County. And of course, Columbia County also responded to the first and second offers that were made. And as you heard, we received a response from Lifetree Women Care. Now, keeping that in mind with what you already know has happened historically, a couple of things I wanted to mention to you. One is we've talked, but we haven't really got into detail about whether or not the authority may wish to pursue a dental program. And just to let you know, We have been working recently with the Columbia County Public Health Unit because they have funds in order to provide dental care for children. It's very difficult to make those programs work. And that's because financially they're difficult to maintain. The thought process here is that potentially if we can do some form of cooperative program, we may find a way that we can support a dental program, which we as staff believe is extremely important to the overall primary care picture. And you've all heard the stories where we've sent patients to doctors. They give them antibiotics, they call, they say, look, this is temporary. I'm not a dentist and this patient's problem is dental. So if we're fortunate and we can make something work in that regard, I think it goes a long way toward providing a better primary care benefit to the underserved population that do and will qualify for our program. The second thing is, again, and this is totally subject to your approval, but I think it's extremely important that our offices where we qualify people for our program be at point of service as much as possible. So when you look at my memo, I am sort of recommending that you strongly consider moving Sonia and I to wherever these services are going to be provided, whatever facility that is, where we can be under one roof. The disjoint logistically was a problem in the past when we had CHS operating Lake Shore. I mean, they would, it's down the street, and when they walked out the door, they got in the car and they left. They didn't come down here. And either we had to chase them down or they didn't qualify, and we had those issues. So I wanted to make you aware of those. And then what I tried to do is to look, and please understand, I do not know right now what it takes to assist Lucretia or what she's looking for. I do not know what is required for the birthing center. I'm not specifically sure what it is Florida A&M may bring to the table. But based on what I do know, I tried to give options for all of these various buildings. And for example, one building that we talk about often is the Women's Center. I could potentially see that building as being the birthing center for that program. It could potentially house the dental program. You could put a primary care clinic and other services there. It could obviously be used for government offices, and potentially it could even be used for educational programs through FAMU. Our job is going to be to vet these new proposals, find out exactly what it is and whether or not we can have a business relationship, and the best way to house those on campus, and the best way to coordinate between the various providers that may be on campus. Now, having said that, I think it's possible that we may take a Dr. Mayo and ask her to consider putting some of these things under her umbrella. It may work out best that way, simply because when you look at carving out one or two offices in a building that has the overhead some of these buildings have on it, it's just not going to be cost effective. You can't charge enough rent to pay that kind of overhead. So I think that's going to be the challenge, is to let's finish vetting these. Let's see where and how they can best fit on campus and under what business model they best work. And you heard the Neals. I have a conference call with them. I've asked Erica, and we'll ask again for her to kind of help me with Florida A&M because she has a rapport there. And we're going to try to find out specifically what each one of these entities is seeking. Obviously, we will tell them if it's beyond what our legal authority is. We will not preclude any of them from speaking directly to trustees. They're welcome to come make presentations if they agree with us. I believe the process has been somewhat open and fair from the beginning, but nonetheless, that's where we're at. And I would appreciate it if you would look at that email I sent. There may be other options. And if they are, we can certainly consider them. But I'm trying to do this in order to keep us on track where we can move forward and do something with these facilities sooner rather than later. And obviously, if you have any questions about any of this material I may have sent you, then just let me know.
To the board.
I'm interested on any updates with the RFPs.
Soon as I get the chance, Miss Laura, to speak to them, I'll try to write up a narrative and send it to you. And obviously, I'll invite Lucretia to come speak again, the Neils to come, Dr. Early, whoever it may be at the appropriate time.
Okay, I have one more question. She's talking labs. The Neils are talking birthing center. Why couldn't they go in the hospital? I mean, they would not use the whole thing. And I realize that. But why couldn't they go in the hospital and use that space? Where the emergency room is now would be a perfect doctor's office. The birthing center where the OR is. You've got other rooms around there, offices around there. You know, I mean, these are things that we could use it for and still use the other buildings for other things. And I take exception to what Sylvester said earlier. We have been faced with the hospital, CHS pulling out, 2 years of COVID. Nobody was doing anything, not anywhere with medical facilities. It took a year after that before medical facilities actually started to do anything. And the people that are involved in medicine, I think pretty much can agree with me. It was universal in the United States. And yet here we are, we're crying because nothing's been done in that time. No, it hasn't. Things are just starting to follow. Now, I'm not saying that we could use that as a hospital anymore. But what if we could take that one building and fill it up with different services and still use the other two buildings for other things? Now, that's something I'd like you all to think about. Plus the fact you all know that I am against Meridian being in that facility. And I want to send you home with the idea. Think about pedophilia. They treat pedophiles who would be coming in and out, whose families would be coming in and out. And there is a good incidence of pedophilia going through a family, not just one family member. And you've got a kid's playground over here. It does not make sense to put all that stuff together. That's my comment.
Can I have a comment?
Close it, Ms. Lovely. Appreciate it.
Bill brought up something that piqued my curiosity.
We'll save it. We'll save it.
Okay.
So any other further comments?
I'm waiting on my other fellow board members, Mr. Chair, to have comments.
I'm good.
I'm good. Briefly.
Yes.
Wow. That was a lot, Ms. Chauncey. I appreciate it, and I did not realize that your position regarding Meridian is as strong as it is, but I do now. On that, Mr. Williams, let me ask you, I noticed you had mentioned in your memo, which I have here, and I underlined several things. The Columbia County Public Health Unit is only interested in dental for children, correct?
That's what they receive funding for.
Correct. And you plan to meet with these other people, Mrs. Smith and the Neals. The Neals is a phone conversation tomorrow,
We have a established conference call tomorrow.
and Mrs. Smith is coming soon.
Yes.
And then you're still negotiating with Dr. Mayo regarding that building.
She and I will get together and continue those discussions. She'll also hopefully help me arrange a conversation with Florida A&M.
Okay, thank you. And looks like we are in a holding pattern, my prediction for at least the next 90 days. Probably until we see anything regarding the final survey being completed, as well as the appraisals being done and notifying the masons. Would I be barking up the wrong tree to ask, what would we gain, if anything? What would be the cost if we sent out another RFP for a 4-story building over there, as to anybody in the world on the last provider that you used to send out this last RFP, to see if there is any interest in anywheres in the world for a 4-story, 100-bed facility, so that we can finally put it to rest in our minds that we're not going to get a hospital. As far as my comments regarding my fellow board member, Mr. Chauncey's comments regarding putting everybody over there under one umbrella, I don't think that would be cost effective, because as you just stated, it looks like we've only got 3 people, maybe 4 at the most, interested in utilizing space. And it looks like what space they're interested in would even take up 1 floor, maybe 1 floor. And then, so that leaves 3, and that's not cost effective for the authority. Am I correct?
Yeah, I mean, we have to consider the amount of overhead. The buildings are older. So for example, the main hospital is not zoned. We have a light bill for the hospital. There's no way I can separate floors.
Yes, sir.
So if you only had 1 or 2 people within the building leasing space, you're still paying the entire overhead for $125,000.
$30,000 a month. Right.
So it would be important, if you were to do that, that you lease out a substantial amount of that space. Otherwise, it's just going to, carrying charges are not going to be sustainable.
And then my thought regarding putting out another RFP to see if anybody in the world is interested in that building. Help me get that out of my mind.
Well, I mean, that's certainly the prerogative of the trustees, but I would ask, is it your intent to say you're willing to gift that building? Or are you wanting to accept offers to purchase that building? And are there any things that you could potentially put in that building that you would consider to be non-acceptable?
Right. All of the above. Mainly medical providers.
Yeah.
An emergency room, 24-hour.
Well, the reason I'm
7 day a
asking
week.
is, we did have previously interest in using the building for like long-term care, that type of thing.
Yes, sir.
Which of course is a different ACA standard. Now, unfortunately, all of those that we previously discussed that with, they wanted financial support from the authority. And when it gets to that conversation, then, as you've heard numerous times tonight, we have to say we can't legally do that. So that becomes an issue.
And thank you. And that's one last comment, Mr. Chair. I just noticed under your memo that regarding the former Lakeshore Hospital, the only two options we have right now is to transfer the ownership or number two, demolish the building at an estimated cost of $3 million. And it keeps going up. It was 2 a year ago. Thank you, Mr. Chairman.
Mr. Neal has raised his hand and I believe it is a response to one of your comments. I'm gonna ask if he would, I'm gonna unmute him right now. Let's see. Oh, I just did it again, Mr. Neal, bear with me, I'm not gifted. Did I do that one right? All right, I'm gonna click on it one more time. There we go. Dr. Neal, can you hear us?
All right, can you hear me?
Yes, sir, we can hear you.
Okay, first off, I want to be clear. I want to go ahead and clear this up. I'm not a doctor. I'm an MBA, and my wife is a nurse practitioner with an autonomous license, which is a new model that was legislatively passed in 2018, which allows us to operate
Independently
independently in a primary care facility.
within my scope of practice.
Right. Now, one of the things that we heard was we do agree that you just can't put all of the services in one building, and you probably shouldn't combine a few of the other ones that we were hearing as we're catching up to speed. But also, we believe that that space can be occupied and it can also probably be self-sustainable from off of the demographics and the population overhauls and all the numbers that we've ran. We think that the place can be sustainable to hold itself even in this particular community within a matter of 18 to 24 months. And those are all numbers that we've been looking at. Secondly, we're trying to figure out exactly what is it that you all want to do with the space here? Because now I've heard, do we sell it? The city is going to pay the bills.
Or they can't pay the
Right.
bill
Or are we
whatever.
donating it? So we just want to know sort of like what exactly is the plan for this space? Because we know that we can definitely duplicate our model in that area.
So, Dr. Derek, sorry, I keep calling you Dr. Neal. Mr. Neal, I think Dale can go over the specifics of where we are with all the different properties, because you're asking about right, if I'm understanding that, he's talking about a multitude of properties. So I think it's
Yes.
probably simpler to deal with that over the phone with Dale to tell you which direction we've gone with each one of the properties. Is that a fair statement?
That's fair, and all of those are potential options.
Yeah.
The RFP response provided for all of that as part of the discussions. So what we want to do is to get to a business model that supports a service that is needed in Lake City, Columbia County. And it's something that we can provide under the umbrella of law that we're required to operate under. And so a number of the things that I heard the Neals mentioned fall into that. And I look forward to talking to them.
Okay, so just to be clear, we are looking more so as it being a medical plaza, as a medical complex in that area, right?
If that's what you wish to look at, Mr. Neal, I mean, you can, I want to invite you over for a site visit. I want to show you these buildings. I want to talk more in depth about what service you provide and what you need to provide that service. Talk about what relationship we could potentially arrange between your company and the authority. I want to talk to you about what services you could provide to the underserved population of this county. And I can tell you what we can potentially do as payment for the services provided to that population.
All right. Including
Those are the kinds of things that you and I and Miss Neal will be talking about.
all right. Yeah, because you're not that far, so we can always do a site visit. We're definitely on board with that and the discussion of from building donation to building lease and to definitely using that particular area and providing a medical complex to provide needs to the community. That's what we're all about at this point. So definitely looking forward to the conversation, Dale. And thank you, board, for giving us you all's time and allowing us to speak. Thank you.
Thank you, Mr. Dan.
Mr. Chair,
Yes, sir.
I know I said I didn't have a comment, but it's some of the conversation I do. And it may be a little lengthy. I want to go on the record once again and remind everybody, kind of like Ms. Chancey did, kind of where we've been, what we've gone through to get us to this point. 2020 is whenever Community Health Systems informed us that they were vacating the property and buying out their lease. We lost a board member. We couldn't meet for 7 months ish, almost, over half a year. We put an RFP out. We had multiple proposals related to the medical field for the use of multiple properties. We've had a company out of Jacksonville that wanted to do a hospital. We had one out of Orlando that wanted to do cardiac
Central Heart Specialist.
We've had long-term veterans care company wanting to do for the VA, housing veterans for the VA. We've had multiple medical related proposals that our staff put RFPs out for and received. So I also take exception with the comment earlier in the meeting saying that our staff hasn't done anything for the last 4 years. That's simply not true. We've had medical proposals. We've listened to those medical proposals. We've turned down most of those medical proposals because, as it was stated earlier, they all wanted, hey, give us the building and $20 million, all the money you have in the bank, or $10 million or 15 or whatever. We had Florida Gateway College that wanted to do a medical school here. It's public taxpayer money that's regulated. We cannot, and I'm saying this publicly because I know 3 of the 5 responders to the RFP are either in person or on the call. We can't just give money away. We can't just say, here's a building, come occupy it, we'll give you free lease. We are not legally able to do that. We can work it out where hopefully, we can do some minor improvements. From my understanding of the law and talking to our attorney, we can do minor improvements to the building to get it to an acceptable level, and we can lease property. I want to make sure that we're not going through a long, drawn-out process and getting everybody's hopes up that we're going to do this. I forgot to mention Dr. White's. There's certain things we just can't do. So I don't want this to drag out forever, and I want everybody to know up front, we can't just say, hey, come operate here and we're going to cover payroll for the first year or 5 years or however long. What we could do is we could contract with doctors or whoever. We could do our own primary care, and I'm not against doing something like that. I would like it to be more than just primary care, whether we use a women's center building or this building or build our own building on one of the vacant properties. That's something we should look at. I think we could do that and contract with doctors to, the way I would like to see it is a 24-hour clinic. I know there's a lot to get to that, but I think it's possible. I would love to see this become a medical plaza. I would love to have a birthing center here. I would love to have a women's health center here. I would love to have a pharmacy here. I would love to have a lab here. I would love to have an entire medical complex here on the Lakeshore Hospital campus and cover all of Columbia County. It's gonna take a lot to get there, but I want everybody's expectations, I want everybody to know what the expectations are, and that we cannot just say, here you go, come do business here, and we'll make sure we cover the cost of your business. We can't do that legally. And I think as far as Meridian, we unanimously voted previously to move forward with that. I don't like going back on my word. I'm not opposed to doing another RFP. If we do, I don't know if it's appropriate in the RFP to put, we're not covering payroll. We're not covering business
Salary.
expenses. We have buildings that we can lease, we have patients, and we have ideas to make our program more accessible, whether it be a sliding scale or whatever. This is what we have, this is what we can offer, this is how we can do it. I would love to see that one day, and I hope that we get to that point where we are a full medical campus. I'd love to build another building. I'd love to build another hospital over here on this property somewhere. It'd be fantastic. And have a pharmacy and a lab and a women's center. I would love all of that. And I hope that we can get there, but I want to make sure that we're clear and upfront with everybody. And back to the Meridian thing I skipped over. We've gone far enough. I tried to be a person of my word, and if we say that we're going to do something, I want to see it through. Unless something comes up, unless something changes. My understanding of the deed and the reverter clause in the deed is, and I don't think we wrote it. My understanding is that Masons wrote that deed when they gave it to us. It spells out what's supposed to be done. So whenever we get that appraisal back, my suggestion is going to be go with the top appraisal, most expensive one, write a check, send it to the Masons. That's the right thing to do.
It's the only thing to do.
It's the only thing to do. And so I don't want to continue. I know it was my idea, and I'm glad we did it because we got three new proposals out of sending out the RFP. And I hope that we can make all of them work, but I just want us to be very clear and upfront with everybody that what we are and are not able to do. And I would love, I think we should discuss it further also. And I don't want to take away from the women care, but if they're focused solely on women and birthing, which I think is desperately needed in Columbia County, I think if we had a 24-hour clinic and we could staff it through doctors that are here or through Shands, I think UF has a program, whatever that may look like, I would love for us to explore that more and start on it. We can start on that while we're going through these proposals.
Mr. Chairman,
Yes, sir.
I just want to thank Mr. Beal for putting my mind at ease that we don't need another RFP. I didn't think we did. I've been here for 29 months. I didn't think we did either. And I'm committed like you are to Meridian. We're that far. They want to invest the $10 million to renovate that building. Now it's probably up to 15 million by the time they get into it. And I'd rather take 15 million, like you say, and add to the complex that we have here with the vacant lots and add the medical needs that are required for this community. Thank you, Mr. Chairman.
I just don't see us, I don't see us spending the money. We could build a new building cheaper than we could renovate that one and get it approved by LSHA to be a hospital again. So I think we just build a new one and we can continue adding on to it until it becomes a full service hospital.
I'll second that motion.
All right. Any other comments from the board on this topic before we move on?
I'd love to hear from Mr. Bullard. I'm just listening. You're learning too. I'm learning a lot.
All right, so the staff report, we've got them in our packets and we are, I know we probably just covered this, but we're just moving down the line. It's board member comment time. So Ms. Chance, any final
I don't
remarks?
have anything additional.
Okay.
None, Mr. Chair.
Well,
No, thank you.
Good.
all right, I'm good. There, you got anything?
I'm fine, sir.
Oh, hang on 1 second. Did I miss something? Mr. Neal had his hand.
He puts his hand up, I want my hand up.
I don't think, he hasn't got it up right there.
Yeah, he just put it back up.
He did put it back up. Okay, Mr. Neal, we're gonna briefly. Well, briefly unmute you. I just want to make sure we didn't miss you and follow up. I know we were speaking to you earlier. Can you hear me now, sir?
Yes, yes.
Okay.
Once again, thanks for letting us get back to you, and we won't keep you long, but just for clarity, just a few things that that I wanted to hit on from the last gentleman that just spoke. So I want to be clear that we are prepared to scale. We're not looking to come into this saying, hey, can you give us this or can you give us that? Once again, I'll be clear, we have a nonprofit and we have a for-profit wing set up. I've done an analysis on the area, on the potential, as far as the private payers and also as far as the Medicaid payers. So even with either one of those with the population, I think that it can work. So we're looking at it from both aspects. Again, we are up, operational and running here, and we're prepared to scale into that area. Also, I wanted to hit on the fact that who you're doing business with, you can look at our reviews online. Reviews tells a lot about any and every corporation. And it appears that the Meridian group that you all are looking to bring in, it looks like they really don't know how to treat their patients or their people or the community. And you really want to take that into consideration when you're talking about affecting the community, especially the underserved community, in a community that's you all size. Secondly, we too have partners that we do business with now currently that have big budgets, both private and also government, and we can provide those wraparound services. I'm quite confident that we can mold that facility into a lot of the things that's happening on this end of the spectrum as well. As you all know, just as well as I know, as far as Jacksonville and growth, it's only one way growing. It's only one way to grow from here, and that's out west. That's down the I-10 corridor. So over the course of the next 10 to 15 years, whether we all like it or not, we're going to be much closer as neighbors, either way that it looks. So it's going to be a population increase even there. It's going to be looked at as a nice suburb to go to get away from the big bustle of the city. And last but not least, I was wondering if just listening to the technicalities and the taxes and the way that you all are maneuvering in this building, I'm wondering if there is any sort of government subsidies or things like that that's available to assist the county and city with it being in this part of the community that's low income and undertaxed. I mean, I know that there's a lot of programs out there just for this. So I was just curious about that. Not that we're asking for it, but I'm just thinking about it. I know that you all have teams that maybe you all can reach out and take in some of those subsidies that's provided for these low income areas. And we are done there. I just wanted to leave you with that.
Thank you, Mr. Neal. We appreciate it.
Okay.
Okay. Just going back around the horn one more time.
He's quite correct in the fact that there are a lot of subsidies available, but you have to have a provider of some sort to apply for the subsidies.
Fair enough. Okay. There are no more board member comments. We've exhausted